Hello, I'm Dr. Lola from Pearl Oncology Clinic, and today I'll talk to you about chemotherapy. So before you come in for chemotherapy, what should you know? The first thing I would like you to know is be calm. Chemotherapy is a difficult treatment to go through. When chemotherapy is being given, sometimes you don't feel anything, or you just feel slight discomfort with the line when the drip is going through. But most times, nothing major happens during the chemotherapy procedure. But you may begin to feel some side effects, some discomfort after chemotherapy, a few days after chemotherapy. Some of this discomfort are associated with side effects. Now, when people are on chemotherapy, they may feel nauseous, they feel like vomiting. Some may actually vomit. It's important to know that you must have a conversation with your doctors with your oncologist on the medications you should use in case you feel nauseous or you're vomiting at home. There are some medications you should go home with, and you should only use them when you require them. Diarrhea, having watery, loose stools, more than 2 or 3 in a day. The consistency of your feces becomes softer or very liquid. This is a common side effect with certain types of chemotherapy. Again, you should talk to your oncologist if this arises, and there are some tablets that your doctors will prescribe if this arises. A common side effect is the loss of hair. It may be hair on the scalp, on the head, it may be the eyebrow, it may be hair in the armpit and in the private part. Usually, the hair will grow back, even while on chemotherapy. And when you're through with chemotherapy, the hair most times grows back. I must mention that not every woman loses her hair during chemotherapy. There are very few women whose hair, remain intact, but most women will lose their hair. But again, the hair will grow back. Another side effect is change in skin color. A lot of people get darker, and sometimes the palms get darker as well as the soles of the feet. Sometimes the palms feel itchy, shiny, peppery. Yoruba people will call it like baja, like pins and needles. If you have the side effects, make sure you discuss them with your oncologist, because there are certain interventions that can be done. However, there are some side effects that cannot be completely removed while you're on treatment. When your treatment stops, then a lot of the side effects will disappear and some of them will reduce drastically. Another worrisome side effect that is caused by chemotherapy is it reduces the blood level. The blood level, which we call PCV, hemoglobin, we monitor them very closely. And that's why before you come for chemotherapy, your oncologist will always request for a full blood count or a complete blood count test. And the reason is we want to be sure that your PCV, your hemoglobin levels are adequate, are normal. We also look out for your white blood cell count, because certain chemotherapy reduce this white blood cells, and when this happens, it may predispose you to infections. And the third thing we look out for is the platelet count. Again, sometimes chemotherapy can reduce this platelet count, and if that happens, the person may be at risk of bleeding. But I would like to point out that when you receive chemotherapy with an oncology team skilled and experienced in delivering chemotherapy safely, they will know how to predict if you will have the side effects. If you are at risk of the side effects, they will find ways of preventing or reducing your risk of developing. And should in case you develop side effects like your blood level goes down or becomes low, they will treat appropriately. I would just like you to know that the only reason why we give drugs as powerful as chemotherapy is because we are dealing with a very complex disease like cancer. And sometimes when you have to go to war with cancer, you really have to bring out the best treatment. Now, this treatment has its side effects, has its downsides, but it's very promising for many breast cancer patients, and it's an important treatment modality. So I'd like to encourage you that if you've been prescribed chemotherapy or you're on chemotherapy, do your best to stay on it Work closely with your cancer care team. Whatever you are experiencing, communicate with them so that they can provide you the right responses promptly. Sometimes when we give chemotherapy, the side effects are a lot, and then we know that we must stop that type of chemotherapy because you are not responding to it the way we want you to. So sometimes the side effects you may experience while on chemotherapy may be moderate or severe side effects.